Dr. Nario at Biointegrative Health Center in Reno, Nevada. You can check them out online and see what they treat and what they're all about. If you want to reach out to me, you can get me at stevemain.com. That's probably the easiest way. Find out more about me and the health clubs I own and so on. So welcome, doctor.
Hi, Steve. Thank you for having me back again. Always a pleasure.
Yeah, it's good information. So I want to talk about, I thought of just some questions that I think our audience out there may have about, because I'm a supplement freak and I take them all. But there's different ways to get supplements or medicines into your body. Uh, Intravenously, injections, muscular into, do it into the muscle, subcutaneous injections, and of course, oral things that you take um, by mouth. So, can you give me an example of some of the supplements or some of the things that are administered in these three ways, or even maybe more ways? Can you just kind of break that down for us?
Right. So I think what you're pertaining to is the different ways that I can give supplements, correct? Is that what you're asking?
Sure, like vitamin B.
Okay. So let's say vitamin B. So first of all, with our audience, I want to explain to them that in our field there are three ways that we actually introduce or add to the load of your body. So one, which is the most common one for us here, which is a big process that we give to our patients for the longest time, intravenous. So the intravenous route is always going through the vein, and that involves us putting a needle in that vein so that you can actually distribute the drug or the medicine or the supplement or the substance um, through the bloodstream. And that's a direct introduction and, of course, 100% delivery. Number two, intramuscular. Intramuscular is choosing a muscle that is actually filled with blood vessels, and you inject a medicine with a needle inside that muscle, and it acts as a depot. For example, why is it a depot? Because you're putting it in storage, and as blood flow now goes through there to slowly circulate it, then you're getting a good small amount in time as that medication stays in your muscle. And then number three, oral supplementation. Oral supplementation is by taking a pill, a capsule, or a tablet through the mouth. And that is now all going through the GI tract, the esophagus, stomach, the small intestines. And again, the absorption in this situation now depends on the integrity of your gastrointestinal tract. So those are three ways or pathways that are actually going towards the same objective, raising blood levels up of a certain nutrient, a vitamin, or a nutrition.
That's interesting. And I never thought about it that way. The intermuscular injection is now you've got a little pool there. Correct me if I'm wrong. You've got a little pool there that your body can draw from. And that's kind of like being time released. Is that right?
That is correct. That is correct.
Yeah. Okay. That's pretty cool. So let's just kind of add on to that. How does your body respond? Like if you do an oral or injectable, or you do an IV drip. Can you just explain to me a little bit about how your body responds to each one of those,
Well, Steve,
and
yes.
how long the benefit is, so on?
Right. Well, again, Steve, that's again those are basically the response is again, I guess, in relation to dosing of how much you can give. I mean, that's our usual concept of if you give this 100%, how much effect do you get? If you give 50%, how much do you get? So it's really all about dosing delivered. So when you talk about intravenous, that's actually 100% delivery. If you can see, there's no you're getting it through the highway so that they can go to their offices, they can go to wherever they want to go. So that's a direct delivery of a medicine when you do IV therapy. So that's why that's the most potent out of all those three, just because of the amount that you can give, and also the potency of the medicine in different types of forms. You can definitely not worry about certain side effects compared to the other ones. So intramuscular, there's only so much you can put in a syringe, maybe 2 3 ml, and the more you increase the mils or the amount of fluid in that syringe, it becomes more painful. So that's why now you consider the tolerance of the patient in relation to the acceptability of that needle, so that you can put the medicine inside. And again, dose, as I said, if you can only put 3 mils, 2 to 3 mils, there's only so much. And also the effect is it's slow, it's time related, because now you need to wait for the process so that the body can all like pick it up slowly. So as you can see the trend here, it's getting slower and slower and less potent from IV, and lastly now to oral administration. So that's the least in terms of absorption capacity, because as you now put it in your mouth, it now travels all the ways. It's like you're gonna go to you want to go to your office, but you have to go through the park, you have to go through the basketball court. So there's so many stops that you need to make before you actually get to your destination. And that's why the oral route, everybody actually is using the oral route, but it's not the most efficient. And imagine if your gut's all damaged up. It's almost like road construction and you can't get through. And you can only like get through like a few milligrams through your intestines. So that's why weakest absorption, but we will still take it because that's the one that we can do at home. And even though we're absorbing small amounts, we will still do, and the most common one that we always do is oral absorption.
Okay, so last question. So, how would you decide as a physician? You have someone coming into your office. How would you decide as a physician? And I know it probably matters what the supplement is. We're talking about vitamin D, but it could be anything. There's lots of things that you administer there at the office.
Mm-hmm.
What helps you determine as a physician how to give these supplements to a person in any combination, or maybe you just pick one? What goes through your head when you're trying to determine what's best for this person?
Right. Well, Steve, maybe the best way to do this are examples. So I choose IV therapies for patients who really want potent effects, potent doses in their system. For example, I have a patient who has a high level of heavy metals. We're not going to remove that through injections or through small pills because it's just in the organs. That's why you need a bigger dose, which actually can go through the blood in 100% fashion. So that's why IV therapy is the better way to go for those type of situations. And same for vitamins. If you're very deficient in vitamins, like an athlete, for example, that's had an Ironman last week, so you want faster distribution of these nutrients, go IV. Add some more hydration in there. So the faster effects to replete the athlete, the faster time also that they can go back and do their exercise again. Intramuscular. Intramuscular is something that I do for specific medicines. Not all medicines can be given intravenous, intramuscular, or and you can do oral. But a good example would be vitamin D. Vitamin D is a fat soluble vitamin. All the fat soluble vitamins should be only injected. You cannot do that through intravenous because you can produce a fat embolism. And also, same concept. The more dose that you can give through that injection of that vitamin, the more you can put in your body compared to oral. So why do I go for oral? And oral is everybody, meaning if you're on the go, you just want to replete something so fast. If you want to do something as a maintenance because you're not here in the clinic and we cannot give you IM or intravenous, oral is always something. But again, absorption, everybody, we don't have the best guts. That's all we need to remember.
Okay, well, this is the last question.
Right, sure.
So, what what happens? Okay, I love the example that you use. Someone who needs to detox, get the metals out of their body.
Hmm.
Would you use a combination? How many IV treatments, and I know you're going to give them more than just probably two or three different IV treatments for that.
Right.
I know, look, I've been doing this with you long enough. I know one's chelation for sure.
Mhm.
Um, but would you say, okay, you need to do chelation once a week for how many weeks in a situation like that? And then would you also add oral supplementation to help get those metals out of the body all at once?
Yes. So the thing here is the concept that I want everybody to remember that we give we give treatments here in the clinic. The thing here is the access to the clinic is not 24/7. Majority of your life will be lived in reality, which is outside. You have a life outside doing normal things. And that's why we give the potent therapies here in the clinic so that you can continue oral supplementation outside so you can keep that momentum going. So even though again it's just, hey, we're not going to absorb it that much, we're just going to waste our money. Not really. You're still going to absorb a small amount. We do have oral chelators, that's right. So we give IV, but we have oral chelators, but are not of the best effect. The best effect we didn't discuss would be in relation to chelation is a rectal. It's a suppository. That's why again it's not by mouth, it's suppository. It's so bad in terms of absorption orally. But since you brought that example up, that's why I'm dwelling on it. But again, momentum. Keep the momentum with oral, and you give the big guns while they're in the clinic.
Yeah, totally makes sense. Okay, everybody. That's Dr. Nario at Biointegrative Health Center in Reno, Nevada. Thanks for being with us, Doctor.
Thank you again, Steve. Always a pleasure. And again, we all know that knowledge is power. And thank you for letting me provide you with edge in longevity and health maintenance, which I call the biological edge or the bio edge.